I call this joint public hearing of the Senate Communications and Technology Committee and the Senate Institutional Sustainability and Innovation Committee to order. This hearing is to discuss and explore how artificial intelligence, or AI, is shaping the future of the biotech industry.
When we talk about AI, it's often in abstract terms: algorithms, automation, and future potential. I'd like to ground this conversation in something that's very real: patient safety, caregiver burden, and how AI is already improving care today. Before I begin, I'd like to ask a quick question. How many of you have a family member or know of an older adult who has fallen? Usually when I ask these questions, most hands go up. And that's because falls are not rare events. They are a shared experience for families across Pennsylvania. I've personally had family members experience falls, and sadly, some of them are no longer with me today. My name is Dr. Eunice Yang, and I'm the founder and CEO of OK to Stand Up, a healthcare technology company focused on fall prevention. Falls are among the leading causes of serious injury for older adults, and the consequences can be devastating physically, emotionally, and financially. This is for families and for our healthcare system. To understand this challenge firsthand, I spent 150 days living in nursing homes, observing the daily realities of care teams and the very real human cost when an older adult falls. To put this into perspective, across Pennsylvania, in hospitals alone, approximately 35,000 inpatient falls were reported in 2024. And the challenge is even more intense in skilled nursing facilities where residents are older, risk is higher, and staffing ratios are tighter. At the same time, nurses and care aides are under enormous pressure. Staffing shortages are not theoretical. They are a daily operational reality. That's what I've seen. Traditional fall prevention tools like bed alarms and frequent rounding can be reactive and very labor intensive. Too often, they alert staff after a resident has begun to move, leaving little time to intervene. And this is where AI is making a meaningful difference. Our product, OK to Predict, uses machine learning to analyze movement data from commercially available wearable sensors. The system identifies patterns that suggest a person has intentions of sitting up from their beds or chairs. When that intent is detected, an alert is sent in real time to a nurse, giving caregivers a window of time to respond proactively. Those seconds matter. Instead of reacting after a fall, staff can intervene before one happens. Instead of constant monitoring, nurses can better prioritize care. And instead of asking an already stretched workforce to do more, AI helps extend the reach of the staff we already have, supporting them in the moments that matter the most. Importantly, this technology does not replace nurses or clinical judgment. It's designed to support existing fall prevention protocols, not disrupt them. The nurse remains in control. AI simply delivers earlier, more actionable information at the right moment. What we've seen in skilled nursing settings is encouraging. In our clinical evaluations of 44 high fall risk residents who were monitored for more than 4,500 hours, staff reported 0 fall incidents during the evaluation period. While outcomes will vary by setting, the takeaway is very clear. AI can help overburdened care staff respond more proactively, improving safety while fitting into existing workflows. From a broader perspective, this is how AI is strengthening Pennsylvania's biotech and healthcare sectors. It improves safety while reducing the burden of care. It helps reduce the financial impact of preventable injuries, and it can ease workforce burnout. And it creates a scalable innovation rooted here in the Commonwealth. That is the impact I've seen firsthand, and why responsible AI adoption is not just a technology strategy for Pennsylvania, it's a workforce strategy, a patient safety strategy, and an economic strategy. Thank you very much for the opportunity to share OK to Predict's AI innovation and for your leadership in supporting AI sustainability and innovation.